excited.
Excellent.
I originally came to visit Merrill because I'm a runner, and I, for about 5 months, had heel pain and couldn't run anymore, and I was getting very frustrated. I tried to do everything I knew to do, and he's a last resort, I guess. But as I came in and he did an assessment and looked at some things that might be other things that might be going on with me that I didn't really notice because I had heel pain. That was all I cared about getting taken care of. But as he was working with me, he addressed a lot of other things that were going wrong. Once the heel started healing, I had other problems. I had some numbness, some pain in the leg, which he addressed and made a lot better. And also he helped me with my neck. I had a little whiplash about 10 years ago, so he worked on my neck, which was really nice to be able to move it for the first time in a long time. So he did address other things that I had no intention of coming in and dealing with, because I didn't think there was anything else you could do, but he did make a big difference. So I really do appreciate all the work you've done on me, because I feel really, really awesome. I do. Just love that I can move my head. It just is amazing.
One of the things that, if you don't mind me saying this, Kate, and I'll edit it out if you do, when she first came in, she had very low expectations. And one of the things I said to her was, you know, dream a little bit bigger. You know, a lot of these things we can take care of and get rid of. She would say things to me like, you know, I want to get this foot fixed, but, you know, I have all these issues in my leg, but I know nothing can be done about that. And I'd say, well, you know, just maybe upgrade your thinking a little bit and imagine that maybe it's possible, and let's see what we can do. Right?
Yes. My neck is hurt for over 10 years from that car accident. I didn't even consider that could be dealt with, you know, after all those years. I don't even think I told you about it, really.
You didn't? No.
No. Thought it just had to be that way, so it doesn't.
As you hold that, as you can probably see, her neck is turning more and more and more. You can often gain a tremendous amount of that range of motion that they've lost, sometimes within 10 seconds. Sometimes it takes 30, 40 seconds, but you'll be actually completely amazed at how quickly you can regain that. And who would have thought that the problem was way down here? You know, we think of those rotators underneath the skull, but this is a very effective technique. Of course, you would do that on both sides. And then you need to re-educate those muscles. The next time I ask her to turn her head, she'll probably stop right where she stopped before. And then I'll just say, well, see if you can turn it a little bit more. And they're surprised because they can't. The neurological system has kind of created a stop where they always stopped before. So you have to encourage them after they leave to bring that neck right through that range of motion that they now have, so that you re-educate those muscles. Turn her head to the left. Now she might be able to use quite a bit of pressure or very little. What I'm doing is holding that vertebrae so it can't follow her skull. So as she turns, this is called a counter-strain technique. Okay, relax. Now I'll turn her, I'm going to keep my fingers in the same spot, turn her head a little bit to the left. Now turn your head to the left again, my fingers in the same position. I've got her head turned to the left a little bit, and she's doing the same counter-strain technique. Okay, relax. Now, keeping my fingers in the same place exactly, I turn the head to the right, and now turn your head to the left again, because we want to release this in every position. If you release it in just one position, as soon as they start using their head, I find that the bones will start to track with the skull. Now, on the first session, when you work on someone, it's asking a lot for them to trust you to do this kind of work. And In some ways this feels a little like the distraction that a chiropractor might have used on them, and then they suddenly jerk. So you have to reassure them you're not going to do any sudden jerking or twisting or anything like that. You're just moving their neck through the range. We're going straight up anterior, and now with my head on her forehead I'm going to push back posterior. So we're getting a really nice movement here. You'll find that the part of the tool that's going to slip into that OA joint is then at just about perfect angle. Obviously you can use your own judgment here. I have the patient with her chin tucked a little bit towards her chest, which is going to open up this OA joint. I have a muscle running from the spinous process of this vertebrae over to the transverse process of this vertebrae. Of course, it will cause the vertebrae to rotate. And so if you were running your fingers down the back and you saw the spinous processes all lined up and then suddenly they're all over to the right, it's because there's a erector muscle tight in there. Now when those go over, this little facet joint here gets a little extra pressure in it, and that sends a signal to the muscles telling them to all to splint the ear. Okay, so you can work through there. Then you can take the little tool and work right in between the spinous processes. There's little muscles, there's little ligaments, little tendons, and you see I can go right in between the vertebrae. Now we know that these spinous processes are coming out and heading a bit inferior. So I'm going to kind of slide in this direction, but of course whatever you feel in each spot. And you want to work through, on some people, each and every one of these little areas and work them through. I could go up one, and I can feel right through the tool. There's the area right there. Dr. Tervel in her book says that these little muscles will cause what people will call bone pain. Of course, to the best of my knowledge, bones have no pain receptors, so when the patient says bones hurt, it's not the bones that are hurting. But these little muscles in here will cause what will be interpreted as bone pain.
Yeah, feels great.
Good. Now, the difference between your patient getting better and just getting relief is usually how precise and how thorough you are. So the more information you have, the more you know, and the more you learn to apply it to the person, you can get tremendous results. Right, Kate?
You're right on that one.